Welcome everyone to today's webinar, The Journey to Enterprise Imaging, Best Practices and Lessons Learned from MetroHealth's CMIO. My name is Morgan Hafner and I'm the Managing Editor with Becker's Hospital Review. We're going to begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box that you see on your screen. We're really looking forward to hearing your questions. Also, today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access that recording. At this time, it's my pleasure to start today's webinar by introducing our terrific presenters. We are thrilled to be joined by Dr. David Kaelber, who is the Chief Medical Informatics Officer at MetroHealth, and Todd Allman at Highland. Dr. Kaelber, I'll turn the floor over to you to begin today's presentation.
Thank you very much for the introduction. I'm very excited to be talking and presenting to this group, and hopefully we'll have some chance for some dialogue at the end, really around a journey that I have helped our healthcare system make. We'll talk a little bit more about really over the last decade. So I'm hoping for many of you, I can shorten that journey for you, but I think in order to understand that, really want to describe in detail sort of where Metro was, what, where we are now, and sort of where we plan on going with our enterprise imaging plan, and then really what the benefits that we've seen from it, and hopefully leave everybody here with sort of best practices and lessons learned, so that regardless of where you are in your own enterprise imaging journey as a healthcare system, you can benefit from this talk. In terms of learning objectives, just to review briefly, really hopefully there'll be three that we'll accomplish here. So one is to describe the MetroHealth journey, which occurred over several years to develop and implement an enterprise imaging strategy. Two, to discuss how other systems have approached their move to enterprise imaging and the rationale behind their choices. Again, I think this is really where Todd will shine, because he really has that broader perspective. And then hopefully through both of our talks to provide some generalizable strategies and techniques to help other healthcare organizations in their enterprise imaging journey. In terms of the agenda, I have it outlined here. First of all, I want to go into a little bit of background about the MetroHealth system. I think what I've learned is, although a lot of health IT initiatives and projects are generalizable, I think it's very important, if you're going to learn about one healthcare system's journey, to understand a little bit about the context of that healthcare system, so that you can put the journey in perspective and see which parts of that would map with your own healthcare system. So we'll start with the introduction to MetroHealth, and then go through in detail about what made up our enterprise imaging journey. What were the goals and challenges from the outset? What was our approach? How did we view governance, which I think is a big part of any enterprise imaging journey, or really any enterprise project? And then really sort of ending that part about our journey with some results and lessons learned, and then some other approaches to enterprise imaging, touch briefly upon the business and regulatory advantages of an enterprise strategy around imaging, and then wrap up briefly, and then hopefully have 20 minutes or so for questions and discussion. So with that, I'll jump into talking some about MetroHealth. So here in the picture, I've captured Cleveland. If people don't know the Cleveland skyline here, this is one of our stadiums here. You've got the Lake Erie to the north here. Well, in the foreground here, this is the MetroHealth system. So what are we? We're located, our main campus is located in Cleveland, Ohio. We have a growing footprint in all of Northeast Ohio now. We're an academic medical center associated with Case Western Reserve University, Level 1 trauma center, which again, for the folks of this talk, we do lots of imaging, particularly around trauma. We are 4 hospitals and approximately 30 outpatient health centers all around Northeast Ohio. We have approximately 1.5 million outpatient visits annually, about 25,000 inpatient stays per year, And just in terms of our payer mix, we're about 2/3 of our patients are either uninsured, Medicare or Medicaid, and then somewhere around 1/3 are commercial pay. Some of our sort of our health IT journey, which again I think is important to contextualize a lot of what we're doing in enterprise imaging. So we started all the way back in 1999, where we were the first public healthcare system to ever install the Epic electronic health record in our outpatient setting. And we went with Epic Care, which is the regular patient care module with Cadence, Prelude, and Resolute, which are sort of all of the billing, scheduling, and registration modules. Then we went with inpatient Epic in 2009, along with pharmacy and the oncology module. Then we started doing things that are sort of unique to electronic health records as opposed to just replacing our paper with electronic health records. So we went with Care Everywhere, which was Epic's Health Information Exchange module, e-prescribing, MyChart, Nurse Triage. Then, and again, I think this is a theme I'll try to bring out a little bit later as well. So in 2012, we signed an Epic Enterprise contract. And so again, I think the way to think about this in terms of enterprise imaging is even by a decade ago, we were really trying to think much more as an enterprise. What did we want to do at a corporate level to affect all of our individual departments and areas and not just let sort of each area do what they want to do? I think it also speaks to the idea, and I'll weave this in a little bit more as well, of core vendor strategies. So we did take this with our enterprise imaging approach as well, a core vendor strategy, and I'll talk a little bit more about some of the advantages to that. But all the way back even a decade ago, we were looking at a core vendor strategy around our electronic health record, and so we signed this Epic Enterprise contract. You can see a number of the other Epic modules that we did there on the left. You can see down at the bottom then, at this point we've got many millions of patients' data, many millions of visits, labs and pathology. Again, I think for the focus of this talk, we have over 4 million just radiology images. And then again, as we'll get to, there's a lot of non-radiology images that I would say even today, I think we know where the non-radiology images are. Even today, I can't quote you the number of non-radiology images that we have. And then we've been on our electronic health record for 20 years. So again, we really like the idea of being able to, with our clinical record, integrate in all of the imaging that's happened over the 20 years too, to the extent possible. Not only were we the first to start installing Epic and then up on the right, but we were the first public or safety net in the U.S. with Epic to ever achieve MRAM. This is the HIMSS Stage 7 electronic medical record adoption model in the ambulatory and hospital system. So again, I think what this means for this sort of talk is, we're very advanced, at least the way we feel, and as well as HIMSS feels, we're very advanced in terms of our electronic health record deployment and use, and that really bleeds over into our overall health information technology strategy and use. So next thing I want to talk about is some of the MetroHealth system goals. These have nothing to do with imaging per se, but again, as another leader, what I found is it's much easier for me to advance my own projects if it's very clear of the way that the projects that I want to advance for the system are well aligned with system goals that were created independent of a particular project, for example, enterprise imaging that I might want to be working on. So what are some of those system goals that we've had? So digital transformation. So again, for many years continues, we've had this really mantra as a healthcare system that the more digital we can make things, the more we can get off of paper, the better it's going to be for everybody, for our staff, for our finances, for our patients, a lot of those key triggers. Managing growth strategies. So again, this not only has to do with growth of our patient population, which we want to do, but even managing growth strategies around the number of systems, health IT systems that we have, the number of data storage and where we're storing the data. And again, we realize that we need to have growth, but we only want to have positive growth, not negative growth. What I mean by that is, so again, from the IT side, the more we can do to decrease the number of systems that we have, improve the storage that we're using, that really helps us manage then the appropriate growth that we must have, but we're saving in other areas because we're managing that growth better. Operational and financial effectiveness, again, we'll get into this a little bit more, but one of the main triggers for enterprise imaging strategy was literally that it would have operational and financial effectiveness, should be decreasing our total cost of ownership, and then operational efficiencies not only on the clinical side, but also on the IT or IS side in terms of managing these systems, and then clinical excellence and patient experience. And again, enterprise imaging wrapped in with this as well, because just this idea of if you had easier access to images both on the clinical side and on the patient side, first of all, it should provide for more efficient and higher quality clinical care and also improve the patient experience. So with that backdrop, understanding the MetroHealth system and then understanding our system goals, how did the enterprise imaging project that I've been leading over the last couple of years hook into all that? So to start with, and again, as I started to lead this effort, I was very explicit about thinking about and trying to articulate clearly for everyone what was our overarching goal of enterprise imaging. So the overall goal was really to develop and implement a true enterprise image strategy to complement existing PACS and provide capture, visualization, and management of all patient imaging throughout all service lines. I'll just pause to make sure everybody's got that. So again, starting from the idea we want all of the technology components under our enterprise imaging goal, and then all patient images across all service lines. So what were some of the additional sort of more goals and objectives as we dig down a little bit? So first of all, we wanted an opportunity to get all important stakeholders input in medical imaging. So all the way from patients, through our patient experience council, to IT people, to clinical engineering people, to people like radiation oncology, dermatology. You'll see the list in a little bit, but we really wanted a forum for all stakeholders that medical imaging touched in any way to have input. We wanted enterprise imaging to get us a strategy that would allow for central image storage for all departments in a single vendor-neutral archive, or VNA, to create one source of truth. So again, the ultimate goal here was that anybody that needed any imaging on a patient in the future, whether that be one of our own staff, a patient, even staff at another healthcare system, medical record staff, they could just go to one place and know that all the imaging for any patient cared for in the MetroHealth system would be there. We wanted to standardize processes, credentialing, ordering, resulting, billing across all imaging modalities and settings. Again, probably anybody's in the imaging space, particularly these days, what do you do with that, that ED resident who's gung-ho and went out and bought a little plug-in for their smartphone, for their iPhone, and now is doing, ultrasound imaging, point-of-care ultrasound imaging in the emergency department, right? I mean, we literally had stories like that. And of course, the answer is that that is not allowable. But the reason that those sort of things happen is because, again, as a clinician myself, we as clinicians, we're geared to not let anything stand in the way of providing what we consider to be high-quality patient care. So if there's not an easy way or a known way for us to do something, we're going to find a different way to do something. So part of the key with our enterprise imaging is we needed to standardize all these things. We needed to make all these imaging modalities available, and therefore then it would be easy to squash and not allow these other things that are just, not appropriate, but were done in the best spirit of patient care. Provide all clinicians access to all patient images via the EHR. again, we've had a lot of challenges where, what happened to that ultrasound that they said in a report was done in the emergency department? Well, nobody knows because, up until a while ago, those images were not stored in our electronic health record. It was just, that person at ED who did it. Maybe they printed something, maybe they didn't. Something like our fetal diagnostic center, all those images were trapped on those servers and the software in the fetal diagnostic center. So really, all clinicians access to all images. We really want patients to have access to their medical images via the patient portal. Again, we see this as a huge patient satisfier. Something that, again, we'll talk about where we're almost there now that we've gone a ways on our enterprise imaging roadmap. But again, this is really about patient experience where when we talk to other places, patients really want access to their images. And overall provide anywhere, anytime access to images through a universal viewer. And again, this is the other piece of it on the technology side, right? So again, when we started this, there were many, many different viewers, many, many different software, which some people may have the security for, may not, but there was not a common user experience, even for those images that were in the same place to be viewed. So what were the challenges that we initially faced? So there were imaging silos that made it difficult to manage enterprise imaging needs and processes. We didn't even understand what all the silos were. So obviously the big silo, we'll talk a little bit more about the big silo, is radiology, but there were so many pockets of imaging that we uncovered as we started along our project. But, clinical staff struggled to access a complete imaging view of the patient. So, myself, I'm an internist and pediatrician, do primary care. So for me, again, when we started this, if it was an imaging done in radiology, great. I could go into my Epic electronic health record, click on the order, see the report, click on the image. If the patient had a cardiac cath, I couldn't see that because all the cardiac caths, they were on a separate system. If the patient had something in our fetal diagnostic center, that was in a whole separate system. God forbid somebody had some intraoperative imaging, who knows where that was being stored. So really, again, even as myself, just struggled to get that complete imaging view. Alignment of enterprise image strategy within overall enterprise IT priorities. So again, one of the things we saw here was that until we sort of got all this under control, each area that was doing imaging was trying to do different things, was putting in sort of mini requests to IT, and it was hard for us to prioritize. And then even things like, as an example, many different areas were using ultrasound machines. You can think cardiology, think OBGYN, think emergency department, think radiology, and even such a thing of we hadn't even standardized the procurement process for imaging. So, one area might be buying GE equipment, another Philips, which again, you don't get the bulk buying power. And also in terms of the support and image storage and everything, all these different vendors, all these different technologies that we'd have to work through, that just caused a lot of complexity on the IT side and then made it difficult to prioritize. MetroHealth needs to do more with less. Again, if you think about some of our overall strategic priorities, we're always looking for one, how can we save funds and how can we do more with our people? And again, the enterprise imaging was framed, and we'll talk a little bit more about this, but the whole part of the drivers for this is we said there should be decreased funding and more efficient use of our staff if we can consolidate, get everybody working together, enterprise strategy, some of these big buckets instead of individual silos. And then historically, radiology managed the medical imaging strategy. And it's, again, I think that made sense several decades ago, but there's a ton of a ton of imaging that now occurs outside of radiology. So really want to, first of all, respect that radiology still has a huge role and is a huge player in imaging, but is not the only player. So how do you give radiology their sort of due, but also get everybody else involved? And then again, this increased desire for patients to see their images. So this is the picture I like to show. So what you see here, if you see this, so we're in one enterprise healthcare system. So in one rowboat, but everybody's rowing in different directions. Everybody's confused about which way we're trying to go. And so, of course, in that model, it's very hard to go anywhere. So that was our situation prior to our enterprise imaging project. So what was our approach? So the first thing, once I'd gotten sort of buy-in to say, yes, this is something we want to do, it is strategically aligned with those core non-imaging MetroHealth strategy goals, I said I would help lead this. So the first one was to try to understand who all the stakeholders were. So obviously, radiology is a stakeholder, but then we started to go through literally department by department and ask, is there any imaging at all that's happening in your department, whether picture taking in dermatology, to point of care ultrasound, to some sort of scope that's being used. And so basically every single department that we ran into had something. So again, you can see dermatology, emergency medicine, gastroenterology, OBGYN, the OR, ophthalmology, dentistry, pathology. So once we identified all these groups, how could we try to drive the cultural change needed to move to enterprise imaging? So we did this in a couple of ways, and again, we'll summarize these as some of the lessons learned. So first, we had to have somebody take the lead. So again, as I looked at this as an opportunity for the MetroHealth system, one idea that came up, well, should we have radiology take the lead? Well, I think we pretty quickly realized that probably wasn't the right strategy, and radiology had to be a major player, but we wanted sort of a more neutral player in a sense. So therefore, partly because I was leading it, but as I talked to others, it really seemed to make sense that the CMIO, in this case myself, would be a good choice. So we took the lead. We really wanted a lot of physician involvement. So even though there were other people in all the different areas involved in imaging, we really wanted to get physician involvement to help drive the change. And then there were other things that were happening during this time, for instance, the push towards more patient-centered care, 21st Century Cures Act, and just growing awareness that patients really wanted their images, and that from a patient experience and patient-centeredness, we should provide imaging to the patient. Just as an aside, maybe we'll get to this in the question and answer, anybody that's been involved in the open note movement, which is the idea of sharing notes with patients, I think, the initial reaction is like, oh my God, the sky is going to fall down if we actually let patients see the real notes and if we actually let patients see the real images. Again, I've spent a lot of time in this space, so the answer is it's just not true, but there's a lot of fear that needs to be overcome in telling doctors and other people in the healthcare system that, yes, we're going to share the unadulterated notes, we're going to share the unadulterated images directly with patients, and in general, they're going to love it, and it's going to be really, 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 really good. And yes, there's going to be a very, very, very small number of patients that are going to be like, oh my gosh, I looked at my image and I see this little spot. I don't know what it means. I need to talk to somebody about it immediately. So there will be some, additional dialogue that will happen through this open sharing, but in general, like the good far, far, far outweighs any negative. Okay, so what about governance? So we did establish an image steering committee with the goal to develop and maintain standardized processes and procedures through all types of imaging through the MetroHealth system, and you'll see in a couple slides that the steering committee is also involved in governance. This gives you a sense of the members. Now you can see on the left, what we did is I was the chair, or the chief medical officer was the chair. We did make the chair of radiology the co-chair, and again, this was partly, part of the strategy to recognize the sort of the outsized footprint that radiology has in imaging. So they get a little bit elevated status on the committee. Then we did include enterprise members that were not directly related to specific clinical areas doing imaging. So we had clinical engineering representation, clinical informatics representation, IS services representation, and radiology services representation. And then we went through from our exhaustive list, to look at all of the imaging domain member representatives. So again, you can see the entire list there. And for each of these in the imaging domain member representatives, we look for a physician representative from that area. And then we created this Enterprise Image Steering Committee that now meets once every other month. For the first year, we met like every month because we really wanted to get a good cadence and felt like we had a lot of things to clean up. Now we're meeting every other month. And then we also put this into our overall governance structure for any operational project, any capital project. And so what you can see here is that now the Enterprise Imaging Steering Committee is part of that first step of the funnel. So any large project that involves imaging in any way is first reviewed by the Enterprise Image Steering Committee, which then goes up to the Clinical Advisory Committee, which then goes up to the IS Governance Committee, and eventually to the Executive Steering Committee. And so this allows these projects to be fully vetted. And again, the hammer here is that this is the way all the funding is allocated. So the whole point is like, if you don't go through these different committees, it's the Executive Steering Committee at the top that gives you the green light to use the checkbook. And so, you know, most of your imaging projects are going to involve funding. And so therefore, if you don't go through this, you won't get your capital and or your operating funds. So it's been very effective now. It's been in place for about a year, where any significant project involving imaging is all either comes from this group or is presented to this group first as part of the Enterprise Image Steering Committee. So what are some of the things in our first monthly and then every other month meetings? What have we done? So we've defined image device and software standards. So it's no longer everybody can buy their own ultrasound equipment. We have ultrasound equipment standards that, you know, if there needs to be deviation, needs to be approved by the committee. We have credentialing standards that, again, are agnostic to where the imaging is being done. There has to be a credentialing process. We identify gap analysis. So as you can imagine, when we started this committee day one, you know, all these things about, you know, joining the VNA, universal viewer, software, you know, different areas were, you know, closer or further away from where we wanted them to be. So it allowed us an enterprise-wide gap analysis to some of these nirvana places where we wanted to get in terms of imaging. Now that we're looking at this through an enterprise lens, then we're able to identify and prioritize imaging needs based on the gap analysis. Then we started to go through a procurement process where we got a single vendor-neutral archive, a single universal viewer. We reorganized because we were on the GE PAC system, and we wanted to go to Epic. Again, remember that Epic Enterprise contract we signed back in 2011, 2012. We were not on Epic's radiology module. So now that we had this all alignment, we're able to prioritize all those projects. Ran it through the governance process. We started with the procurement. So literally now in about 2 weeks now, on July 10th, we're going to be going live with a single vendor-neutral archive, a single universal viewer, going live with moving to Epic's radiology module, and we'll have all the radiology, cardiology, and OBGYN images all together. And that's sort of been a huge project that we've been able to move forward over the last 18 months. And now we also know where those other buckets of images are, and that's next on our roadmap to eventually get into the VNA integrated with Epic that uses our universal viewer. Also through this group, we defined, sort of what is an image. And again, that might seem simple, but it might be more complicated than you think. So what is an image that we want to consider part of the legal medical record? Image retention, how do we want to handle that? So now we have, standard policies. Management, access, image exchange, release of information. So all those things were covered in the committee. Some of our guiding principles, this is one example. So all images will reside in the VNA. Now again, this is both a very tactical principle and also a strategic principle. So, as an example, right now we have some dental clinics that use Dentrix. And so right now, Dentrix is incompatible with getting images into a VNA because they have a proprietary image format. So again, as part of this strategy, once we identified that as a gap analysis is one area, again, we're not at the point yet where we're saying, okay, this is an emergency, let's rip and replace. But what we're saying now is, okay, as this Dentrix, software comes up for renewal, as we have to go through a request for proposal process, now in the back of our mind, one of our key criteria is we've got to eventually get these images into the vendor-neutral archive. So as our normal other purchasing and other decisions are being made, now this is one of our guiding principles that we take into account. And again, this is just an example of now that we have the Enterprise Image Steering Committee, now that we've got these guiding principles, those are baked into our business processes as we're moving forward. Centralizing images in the VNA, creating one source of truth. Again, I think we've talked about this some, although I will say there were, and I won't name names because this is a public forum, but there were some groups of providers in our healthcare system that were vehemently opposed to sharing their images so that other providers outside of their specialty would be able to see that. So now we had a forum with which these concerns could be raised, we could address them, and then come up with a uniform policy that ended up saying, no, our policy is we are sharing images. What are some of the technology solutions now that we've, again, when we had our gap analysis, we have visibility into and now alignment. So in terms of our enterprise solutions, I already talked about Epic is our electronic health record, sort of single source of truth for providers to get images. We have centralized, again, with our core vendor strategy on the Highland Accuo VNA, the Vitria Viewer, PowerShare and Care Everywhere for image exchange with other partners, and then the Sectra as our enterprise packs. And then you can see the departmental solutions that we've got. And again, this is what I was a little bit alluding to before. So again, we're not necessarily just ripping out all these departmental solutions. Some of the departmental solutions will need to stay for varying reasons, and we need to get a conduit to get those solutions into the things on the right, the things on the left, those images into the enterprise solution. In some cases, we can actually, over time, get rid of some of the things on the right because we can replace them with enterprise solutions. But this is a journey for us. I mean, so far we're about 2 years into it. I think my guess is, I'm telling people it's probably going to be on the order of 3 to 5 years before we'll really be reaching that vision of every single image that's captured on the right into our enterprise solutions on the left. But we've already, again, it's sort of like a 80-20 rule. So we've already got, by the time we do cardiology, radiology, and OBGYN, that's probably something about 80 to 85% of all of our images are already into our enterprise solutions. Now we've got to do the last 15%. This just gives you a sense, again, part of what the Enterprise Image Steering Committee does is we came up with this timeline, again, really going all the way back to, January of 20 when we started this. And now every month and then every other month, we're looking at this timeline. We're seeing how we're doing with it. We're seeing what needs to be added, after we do things. So we've got enterprise visibility, and everybody involved in imaging is signing off on the timeline, knows what the timeline is, knows where their project is fitting in with this. So lessons learned and results. So try to highlight some of the takeaways, if there's sort of one slide to focus on. So imaging today is an enterprise interdisciplinary activity in healthcare. So you have to recognize that imaging is no longer the domain of just radiology. So I think part of the key here is for executives is that once you recognize that imaging is an enterprise-wide activity, then it needs to be managed from an enterprise perspective. So 2, to be successful in enterprise imaging, a healthcare system needs to have, at least in my experience, committed leadership. So you got to figure out who the leader is, has to have an interdisciplinary team, needs to have guiding strategy and principles, I think needs to have a core vendor strategy, and needs to have centralized governance. Again, I think depending on your healthcare system, the details of what these look like, may be different than what I just talked about in the Metro system, but I think you need to have all 5 components to be successful. And then, again, I'd say the third point here, I mean, this is not a sprint. This is a marathon. So I'd say after decades of struggling and 2 years in the making, MetroHealth is now on its way to improved efficiency, effectiveness, and value to patients and staff in the healthcare system from our enterprise imaging strategy. And I think we've got the building blocks in place so that we will be very successful in this space in the years to come. So now, again, just to use that analogy, so if you remember probably about 10 or 12 slides before, we had the rowboat with everybody rowing in different directions, pointing in different directions, didn't know where we want to go. Well, now, at least in terms of enterprise imaging, we've got all the right people in the rowboat. They know the direction they're supposed to be going, and everybody is rowing in that same direction. So I think with this, again, I've given you the MetroHealth story. Again, I'm sort of, very deep in the MetroHealth story. So wanted to turn it over to Todd now just to talk about his experience. Obviously, he's worked a lot with Metro, but he's worked with a lot of other healthcare systems as well. So hopefully give some perspective on how other systems are very similar to MetroHealth and maybe a little bit different as well in their journey. So with that, I'll turn it over to Todd.
Thank you very much, Dr. Kaelber, for that great trip through your journey. We thought it would be good for the audience today to get a vendor perspective as to, what health systems and physician practices are using to initiate enterprise imaging. My name's Todd Allman, and I consult with both health systems and physician practices on their journey to enterprise imaging. So with that, there are some things that are really good and a kind of a standard approach to taking. And if you go down this list, a lot of those MetroHealth really aligned with. This is something that regardless of your situation or your organizational goals and what we may discuss from the other health systems, really helps not only your vendor, but your organization achieve really the best outcome. So, as you see in number 1, determining your clinical imaging environment, it sounds easy, but as Dr. Kaelber mentioned, it could be very, very difficult to know where images, what image, what is really going through the organization. So what really benefits is to kind of take this global approach to talk to different stakeholders, find out what types of imaging systems actually exist. We oftentimes, consult with organizations that we don't know. I mean, that's really the norm is we really don't know what some things are going on. And of course, we want to understand the needs of the organization for these things. We want to take what we've learned and understand what could be early wins, both from a clinical and business perspective. A lot of this is really communication, and a lot is kind of organizing. Number 3, moving to the stakeholders. We can't get away from that communication within our organization to pull this together. Sometimes that's the most difficult aspect of a strategy, whether it be with your EMR or whether it be with your imaging, is to communicate and understand the needs of the stakeholders and to align the strategies with the organization. Dr. Kaelber went through a great governance process that's, I think, would be great to kind of communicate to the group in how to kind of organize the governance, leveraging some of the initial successes in departments and service lines that have been digital, but understanding that workflow as we move through a enterprise imaging strategy will be different for the organization. So determining short and long-term goals and defining that solution and what outcome you want really helps in number 7, that vendor to really design a solution to meet your organizational goals and to be able to target that to exactly how you want to phase that approach. A lot of organizations go 1 to 7 on their own. There are also consultants within the industry that can help you with these if you need that. So that was really kind of a common template and checklist for every organization, but oftentimes, you know, MetroHealth had their strategy, but we run into a myriad of approaches depending on what your organizational goals might be, depending on what's happening in your market. You know, here's a group of health systems that we've actually encountered. And some of these health systems initiated an enterprise imaging strategy based on these events. Sometimes this happened to take a mid-course correction as to they were going one direction, but either, you know, something changed within the organization to kind of change course. So you may be a health system where mergers and acquisitions are really bringing together multiple systems. Could be separate EMRs, probably definitely multiple imaging systems, and there's a need to really share information, including medical images, among your health system. We've run into instances where, say your competitor is across the street, and you buy that competitor or you acquire that competitor. Well, now we need to share that information. And enterprise imaging can be used to kind of leverage that and get you on the right footprint to kind of merge those organizations for best clinical collaboration and success. I think Dr. Kaelber mentioned, you know, a lot of organizations, since radiology is the biggest player, we can easily get our radiology results reporting, but there's a lot other very, very important information for clinical collaboration going on that we don't know about. There's also security concerns with everything going out there. I mean, we've encountered one organization where, you know, photographs and other types of images were being emailed to the EMR in order for that physician to post from their personal email into the EMR, so that was recorded in that patient's chart. And of course, we know that's not the way to go, but physicians need to treat their patients, and enterprise imaging is designed to streamline all that and get all that information into one longitudinal record. Another common theme is a legacy departmental imaging system becomes end of life, and it's not just radiology or cardiology. We're seeing ophthalmology systems become end of life. We're seeing dental. We're seeing, you know, endoscopy solutions really across the board, and this can really trigger you know, maybe a look into whether a more enterprise approach, a solution that moves across multiple service lines, can perhaps serve as the entry point to solve that departmental solution, and then to move through your organization and leverage that everything across all service lines. A lot of folks are looking to leverage those EMR departmental workflows. Dr. Kaelber talked about Epic. You know, we have a lot of organizations now trying to move from, you know, each department running their own workflow toward leveraging what the EMR provides. So you really need that imaging component to support the workflow from an information and reporting perspective of that department. Enterprise imaging can be introduced in that scenario. Dr. Kaelber mentioned the escalating nature of point-of-care imaging, ultrasound, devices that are being bought and brought in the door by physicians, and you know, they all kind of have their own cloud-based storage for that physician. Enterprise imaging can be brought in to get your arms around the nature of this very, very escalating and important aspect of imaging in the ED and OBGYN clinics, and this could be a big one because this is normally, a PACS or an EMR system is normally not where we want these. And sometimes we pigeonhole those in there as a workaround, but this is where enterprise imaging can really leverage those things effectively. Some organizations we find have multiple viewers or multiple kind of aspects where, you know, physicians may look at one system for cardiology imaging, one system for radiology, another system for some type of a dental or ophthalmology. So sometimes you want to simplify across all service lines and into your EMR and be able to really streamline that, to simplify, to improve the user experience and not lose that data. So enterprise imaging can just work on the visualization side for your physicians so that we reduce stress and give them all that information that they need to treat patients. And then we also have, Dr. Kaelber mentioned, whether you call it consumerism or patient access to the imaging. Imaging enabling the EMR it's going to happen. And we want all of the images there, not just one particular service line. So that's another entry point for organizations. This talk is not about kind of a regulatory or 21st Century Cures Act, but we just wanted, you know, as leaders, we really have to look at where the ball is going, where things are moving. I mean, 20th Century Cures Act was passed years ago. It's starting to be implemented. The crux is the prohibition of information blocking and to be able to share certain results with patients. And although imaging as images are not currently stipulated to be shared, very, you know, innovative healthcare organizations are already looking at this and saying, well, where is this going? It's eventually where the theme and the view of this is to share all information across systems and with patients. And they're getting on board, getting the images out there to patients, you know, before those regulations actually stipulate that. And then we have to kind of go from walking to running. Dr. Kaelber, do you have any other particular comments on the 21st Century Cures Act within your organization?
Yeah, I would just speak briefly to, I think, you know, anytime there's regulatory things, you know, if you looked at that one slide, you know, at this point, I'm trying to manage, you know, on the order of almost 20 different systems that have imaging information. So then whenever there's a regulatory thing that deals with patient access, information, whatever, I've got to think about that separately for 20 different systems, where hopefully, again, in that 3 to 5 years, if everything is going in either into Epic and or Epic through the vendor-neutral archive, then I've only got to look at 2 systems anytime there's a regulatory change. So there's a lot of administrative and operational efficiency that I think you get from an enterprise imaging strategy that really consolidates imaging systems.
Thank you. And really the last slide, just looking down the road within your organization as where might be the holy grail or where we really want to be for providing, you know, that unified view for physicians. A lot of healthcare organizations are actually looking beyond enterprise imaging and looking at this strategy of unifying all image-related clinical content for a common view for the physicians and caregivers. So in this slide, we're actually showing the enterprise imaging. So we're talking all image, any image of the patient that was, you know, related to a diagnostic test, where it'd be an X-ray, a photograph, a video of surgery, with the enterprise content. So what may be on your document management solution leveraged by your EMR, so any types of transition of care, financial types of documents, that we merge all of this content that actually lives outside your EMR so that as it's accessed by the user, they get that, total experience of everything under a single pane of glass. Of course, Highland, being a vendor that supplies both of these solutions, we have some innovative stuff we're working on, but you can also leverage some of your integrations, new FHIR integrations with your EMR, with your imaging solution, and bring this all together for your users, which would be quite powerful. But as you see, until we get a handle on the enterprise imaging, it's really hard to go to these even higher levels. So with that, Morgan, I'll turn it over to you for final Q&A.
Sounds excellent. Thank you so much, Dr. Kaelber and Todd, for a really fantastic presentation. We will now start today's question and answer session. So if you haven't already, please submit any questions you have for Dr. Kaelber or Todd by typing them into the Q&A box that you see on your dashboard. We'll try to get through as many questions as we have time for today. And I'm going to start with a couple that I believe are directed at Dr. Kaelber, but Todd, feel free to weigh in as well on these. Dr. Kaelber, the first question is around radiology informatics. And someone's wondering, do you have dedicated radiology informaticists? Would you describe their role if you do and how they work in imaging?
Sure. So yes, we do. So I am the CMIO. We have an associate CMIO, and then in each of our service lines, we have what we call associate directors of clinical informatics. So there is an associate director of clinical informatics for radiology. It's a 0.1 position, so 10% effort. And again, that person is responsible for sort of anything informatics-y, IT related to radiology. So that person has been involved in the imaging enterprise project, as one piece. They're also involved in, we do a lot of radiology clinical decision support. But anyway, at the end of the day, yes, we have one associate director who's a radiologist who's 0.1 or 10% time.
Got it. Great question, and really thank you for the clarification around there. Appreciate it. Next question for you, Dr. Kaelber, is about EPIC. Someone's wondering, when you say EPIC radiology module, are you referring to Radiant RIS?
Yes, I'm referring to Radiant, the radiology information system. So yes, people, I don't want to make it vendor specific, but EPIC doesn't have a PACS system, so that's where we're still using the Sectra PACS, but we're implementing a Radiant, the radiology information system that EPIC has.
Great, thank you so much. And audience members, if you do have a question that's coming up as we're going along with our dialogue, please submit those questions and we'll get to them. We have another really interesting question that came in, Dr. Kaelber, for you. This audience member saying, giving all stakeholders a forum to share sounds pretty daunting, and so they're wondering, how did you do it and then make sense of all the input?
Well, it's a journey, right? So, but first thing I would say, again, this is sort of, my sort of principle as CMIO. If you think there's lots of opinions out there, the strategy should not be to only find and listen to some opinions, right? And I'm not just saying for enterprise imaging in general. To me, my approach is I want to find all opinions, because I'd much rather have sort of chaos in the beginning of hearing all the opinions and trying to figure it out than only listen to a few people, make a decision, come up with a plan, and then hear other opinions later. Right. So again, I would just say we really did a good job. We want everybody. It's not just enterprise imaging. This is our overall strategy. We want a whole bunch of opinions. And I will say what it leads to is that's why we had meetings every month for the first year. It leads to a bunch of chaos to begin with. But I consider this good chaos, right? And you got to manage it. You got to set the sort of the ground rules that we want to hear all the opinions, and we want to try to come to consensus about what we want to do. But at the end of the day, we've got to come up with enterprise solutions. Again, my experience is if you include everybody, and then you set some of these ground rules, and you give several months of sort of working through all that, it works out. And in my own experience, it's much better than not listening to anybody and then be sort of blindsided later, or have real big constituencies feel that they were left out, and that's a whole different thing to try to recover from, which is much more difficult.
Yeah, and I'll add to that as well. This is kind of also where you find, there's some departments that are really protective of that solution that they use. But I think you'd be surprised, a lot of departments, when they look at the advantage of the whole image sharing of an enterprise approach for all this information, and they can actually share these things where maybe with their only, departmental solution that they can't, you'd be surprised at how well physicians are willing to come in and, compare, contrast, talk about the advantage of this enterprise approach. And we find, in most instances, in some instances, there are departmental solutions that really do need to be in place because they provide some very kind of advanced visualization capabilities. But about 9 times out of 10, we find those departments really kind of come on board with the enterprise imaging strategy. So it's just that, as Dr. Kaelber said, maybe that initial chaos to open the door, and then things settle down relatively quickly once the dialogue begins.
And I would just build upon that too. The key to these types of interactions is, I was just say, the key to these types, that you've got to understand what's the win for everybody, right? And so some people may feel like they're losing a little bit, but you got to sort of package it so everybody feels like what they're gaining from this is much, much greater than anything they might be losing. And again, I think enterprise imaging actually lends itself really well to that, but you got to sort of package it with that intent in mind.
Just some excellent observations from both of you. Thanks so much for diving into that and sharing your personal reflections as well as what went on at your organization. So just excellent to hear that. Kind of a question to follow up with that. We're talking about teams and getting that buy-in from them, but what about at the executive level? How do you go about getting an executive team sold on the move to enterprise imaging?
Great question. So to me, I sort of alluded to a little bit earlier, but I think it's got to align with the system goals, right? So again, I knew what the system goals were. As soon as I go to the executive and say, hey, I'm not going to tell you what, I didn't actually do it, but this is the idea, right? I'm not going to tell you what the idea is, but I'm going to tell you about an idea that's going to save money, make us more efficient, make us more operationally good, improve patient experience. Do you think you'd be supportive of an idea like that? Of course, the answer is going to be yes. And then, oh, great. Well, let me tell you now about the details of my idea, right? So it's all about packaging it to the alignment of, the overall system goal. And then I think, to me, there's 2 parts. One, it's selling the executives on the idea, but then it's also figuring out who's going to lead it, right? Because the best idea in the world, if you don't have the right leader, isn't going to go anywhere. So to me, basically, to go to the rest of my C-suite and say, hey, I've got this great idea. It's well aligned. Do you agree with the idea? And then, of course, they say yes, but who's going to make it happen? And then I say, well, I just want to sell you on the idea because here, I'm raising my hand. I want to try to make it happen if you just give me permission to make it happen, and then we're going to support me when I come to you with the details that I need to do to make it happen.
Just fantastic advice there. And I know we're coming up to the top of the hour here, but Todd, is there anything you want to add to that question? And then Todd or Dr. Kaelber, just any closing thoughts that you want to share today?
No, I'll just add real quickly what I see, and really it is aligning your enterprise imaging to those enterprise goals. And if you think about what we've all done with EMRs over the past years, huge investments in you name your vendor for EMR, and to coordinate both inpatient, outpatient, get all the clinics, all the docs on the same page. How can that truly be implemented where we have 5, 10, 15 silos of medical images that are a key part of that diagnosis, reimbursement, collaboration, and treatment of patients, how can that EMR truly be optimized without enterprise imaging? And I think along those themes, numerous both business and clinical justifications can be made to leadership that really, really makes sense for this approach. So I couldn't agree with Dr. Kaelber more on that.
Just fantastic. And just go ahead, Dr. Kaelber.
I don't really have any particularly profound closing comments besides what I've already said. I would just say I think on the slide that hopefully people can see, both Todd and my email address are there, and I'll speak for myself, and I think I speak for Todd too. If there's a question that you posted that we didn't have a chance to answer, or you have other questions, feel free to reach out to us. We want to help people, because I think, to be honest, the more of the country gets on enterprise imaging, the more it helps, all of us as providers in healthcare systems. So happy if people want to reach out to us afterwards.
Appreciate that so much. Thank you both. And it's just been a fantastic conversation today. And I want to thank Highland as well for sponsoring today's webinar, and our audience for really some thoughtful and great questions to base our conversation, our Q&A conversation on. So appreciate it. Please enjoy the rest of your day, and we really look forward to having you join us for future webinars.